today's episode of Flattening the Curve. I'm your host, Paulette Payne. This evening, we have some amazing women joining us. They span the gamut of the healthcare industry. We have Kimwona Mobley. You'll hear me refer to her as Kim. We also have Tangie Henry and LaTanya Tara.
Hi.
Hello, everyone. Thank you so much for joining us tonight. And we'll go on and get started. As we all know, these are unprecedented times. We've never seen, not in our lifetime, at least in my generation, something as devastating as the COVID-19 global health crisis. I literally prayed how I could impact or how I could contribute to the conversation. And God inspired this 4-part series. So I dedicate it to him. I dedicated it to all those who are suffering, who have lost loved ones, those who are on the front lines, even my guests tonight. So we'll go on and get started. And before we get started, I would be remiss if I did not thank my technical and production dynamic duo. Candace Green, thank you so very much. Alexis Payne, thank you so very much. In terms of housekeeping, as you watch this, please share it with your network, because information is power, knowledge is power, but it's not power unless you use it. So please, certainly use the information by sharing it with your networks. All right, so Tangie, let's go on and get started. I understand you work in a local Atlanta hospital. You work on a maternity ward. And before the show, we were talking about what COVID-19, the impact that it has had on your hospital. Can you walk us through what that looks like from the moment that, it hit our state to present moment?
Yes, so first of all, thank you for offering this platform. I appreciate it. I'm very honored. I've been wanting to find a way to share my voice as well during this time. So thank you for this. So I work on an antepartum unit. What that means is that I take care of moms who have concerns before or after their pregnancy. And so our unit is considered a long-term unit. And usually it's more, we do a lot of coping strategies with moms and try to allow them to just buy time to be able to have their baby successfully, or after if they have some concerns. That being said, they're used to having visitors and family involvement. And so soon as when they started doing some of the shutdowns, then our unit became a locked unit and they were not allowed to have visitors. And so that impacted them initially, just the emotional and psychological impact of that. If you can imagine being in a hospital on bed rest for 30, 45 days, and now we're saying that you can't have your family visit. And so it took, like the rest of the country, it took us a while to get into a rhythm. As weekly as things began to change, then my hospital began to make adjustments. And so we've gone from, as healthcare workers, from just being more of a more relaxed unit to now we're wearing masks. We're asking the patients to wear masks even before delivery. We're not allowing visitors. No one can walk the halls. And so it's a very intense time, which should be more of a joyful time for the mother.
Certainly. And of course, I understand that this has changed the way you work. This has changed the way the world works. And not only do you have to perform your duties and your responsibilities based on your expertise, but you have to wear additional hats. I can only imagine that, you have to serve as counselor, you have to serve as friend, you're being stretched in ways that you may not have been stretched prior to COVID-19. Can you tell us about an experience maybe you've had with a mom who has been diagnosed? What was that like for you as the caregiver?
Sure. I think the biggest thing, and I think that everybody that works bedside can understand this, is that when we enter into a patient's room who is COVID positive, then we do have to have on additional protection, which is called PPE, which has been very popular in the media. And like other hospitals, my hospital was a little slow to get us proper equipment. So having said that, to get into my patient room, it takes me about 10 minutes. And that is for me to be able to put on my gown, double glove, 2 masks, face shield or goggles, hat, and all of that. Having said that as well, no one else goes into the room. So we are the additional hats that you speak of. We are, as nurses, we are the confidant and the friend and the caregiver and all that. But now we're also housekeeping. And now we're also environmental services. We're also, we don't have a tech that comes in to assist us. So we are everything to this patient. And so just in particular, what the thing that struck me the most is that because I do generally work on a unit where if my mother has a problem, then I have a solution. We either have a medication for her or we get her delivered. And so COVID just really struck me personally because my patients are not getting better and I'm not used to that. And the thing that's unique about my situation is that I'm not only concerned about the mother, but I'm also concerned about the baby. So I might have a typical 33-week pregnant patient who has other children at home, and she's young, 28, 29, and she is having she has a low respiratory volume. She can't keep her saturations up. So if she's not getting air, then her baby's not getting air. So we're constantly monitoring the baby. I'm in all my gear. I'm trying to hold her together. I'm trying to hold it together. Oh, and then my phone rings. I have another patient. I have to doff all of that stuff off, decontaminate, re-dawn again, go into my other patient's room, and then my monitor's beeping. I have to run out and go to another patient. And so it's very, 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 very straining on the healthcare workers. And then to be able to also just try to provide the care the mother needs. I've had several moms who had to transfer to ICU because we could not keep her saturations up. And in the meantime, we still have to monitor that baby and decide at a moment's notice if she needs to be delivered. And so our unit has been set aside where if we have to deliver her at bedside, which would be an extreme emergency, they've set those systems in place. And so it's very scary for both the mother and us, those of us who care for her.
I can only imagine. Thank you for the sacrifices that you're making day to day, day in and day out. Tara, I know that you work in oncology as a research specialist. While you may not have personally worked with COVID-19 patients, you've experienced it firsthand, if you will. You were sharing earlier that you've had coworkers that were diagnosed with COVID. How confident are you in your hospital's preparation and care for its staff?
Well, initially, being that we're in the outpatient setting, I've been doing oncology for, I think, 16 out of 20 years of nursing. And initially in the outpatient setting, I think we were a little slow to get on board with how well the nurses needed to be equipped with protective gear as well, which is, I think, the reason why we had several nurses that were diagnosed with COVID and luckily have fully recovered, but some were quite ill. So I don't think that we did the best job in the outpatient settings. You know, usually when people are thinking about getting that protective gear to nursing staff, physicians, they're thinking ER, which is your front line. They're thinking your paramedics. They're thinking your surgical staff. They're thinking your ICU nurses. But we've gotten better measures in place. There's no one that can walk around without a mask on. As well, we as staff have our temperatures checked fairly throughout the day, 2 to 3 times, even in an 8-hour work period. As well, unfortunately for the patients, they can no longer have guests, as Tangie was saying. So it's very hard to be have cancer, going through treatment and going in for chemotherapy and being alone and sitting there by yourself, which is very scary. So a lot of people who are able are driving themselves and they're alone, and some that are not have staff, have family members who are sitting in the lobby waiting for them to get done. Mm-hmm. So it's been very solemn. It's not a morbid place. I've been in oncology a long time, and actually are a lot of beautiful stories that come out of it, although we hear so many sad ones. But it is very difficult to watch the patient go through such a trying time by themselves. However, as Tangie said, visitors have to have masks on. Their temperature has to be checked. They have to go through screening when they enter the building, which is, have you traveled outside of the country? Have you been in contact with anyone who is sick? Do you know anyone with COVID? All those questions are in place for staff and visitors because it's affected all of healthcare.
For sure. You know, not a day goes by that I don't consider what life would be like for my family if I were to contract this disease. You know, we hear and we see on social media all the time, at least I do in some of the circles that I'm in. I'm not worried about it. You know, I'll protect myself, I'll wear my mask, but I'm not worried about it. I need to get back to work. And while, you know, certainly so many are struggling at this time, so many people need an income. Yes. I argue, though, life and being able to earn an income, you have to be here to earn an income. So we must take the measures now to ensure our health, our wellness, that of our family. COVID-19 is not about you.
It does not discriminate, and we've all learned that.
Exactly. So we must be sensitive and respectful of this disease. COVID-19, it doesn't respect any person. We must respect this disease because it could happen to any one of us. Kim, I understand you too work professionally, of course, but directly with COVID-19 patients. When you went to work, well, when you saw the headline, realizing that this disease had made its way to Georgia, did you ever consider, oh my goodness, what have I got myself into? Did that ever cross your mind as a nurse, as a practicing professional in the medical industry?
Honestly, it did not initially cross my mind until we became a COVID unit. When I showed up at work one day and they told me our unit is completely COVID now. We only have COVID positive patients. And I work in an ICU. So by the time people get to me, they are at a critical state, which makes it even more difficult because, like Tangie said, it takes 10 minutes to get into a room, getting all the gear on. So imagine you having a critical patient who their oxygenation is decreasing by the second, and it's taking you 10 minutes to get in the room because, of course, so it's been a completely, it's just been interesting, if I can say that. It's just changed the way that we do things all together on my unit. It's just been, I mean, a lot of us have just been anxious and stressed. It's just a different way of nursing altogether.
How are you coping? How are you doing? How's Kim doing?
Well, initially I was very anxious about everything because it's all new and you don't know what to expect from it. Every day it was something different. A lot of the policies were different day to day. The patients were changing, like the way we would treat them. Just everything was different every day when I went to work. So initially I was very, very anxious, but I talked to other nurses. I prayed about it. And then, getting to work with the patients, like the other lady said, knowing that we are the only access that they have to anything. We have to step in and be their family members. We have to do sterile processing in the room. Like she said, we do everything. So knowing that they need us in such a great capacity, it makes your heart reach out to them and to their family members because they can't be there. So for me, it's been, I feel like it's a blessing to be able to provide those services to my patients. and to be able to stand in the gap, I would say, for their family members, it's a huge blessing. And to be able to also, support the family members from a distance, kind of giving them updates, keeping them hopeful, letting them know, what's going on, what we're doing, and just trying to stay positive, really.
I was listening to NPR, I want to say Friday, and that was the conversation. That's what the interview was about. Nurses, medical professionals standing in the gap. And sometimes, many times, them being the last point of contact for that patient. And I put myself, as I've said, in the shoes of those who have lost loved ones. I can't even imagine what it would be like to be in a bed, relatively conscious, and not knowing if you'll ever see your family again. That's quite admirable. What the three of you do, it's admirable. And I would even go so far as to say angelic. So thank you for the services you provide. Kim, is there a standout patient that you treated who is either recovered or no longer with us?
Sure. I've had a few that really, that I've bonded with, but one in particular that I took care of for 4 nights, and it was up and down with this particular patient. Every time I turned around, I was in that room to the point where we normally have 2 patients to 1 nurse. I couldn't even have a second patient because he was so labile. It was like I would go in the room, he would be improved once I did 30 minutes of whatever, and as soon as I walked out, something would change. So 4 nights of just struggling, fighting, keeping, just keep trying to do everything that we could to keep him alive. And I bonded with his wife because we have iPads, we can FaceTime with our patients' families, which is a good thing. So I formed a bond with her because she couldn't be there. Of course, we're not allowing family members at the hospital at all. And so she was also COVID positive to top it off. So she was concerned about herself. And this particular patient, it seemed like the last night that I was with him, that things were on the upswing, it was going to turn around. And the very next night, I found out he passed. And so when I got back to work, I'm looking for my patient. I'm like, where is he? And they told me that he passed away the very next night. And I thought to myself, oh my God, you kind of take it on yourself, because I feel like, well, what if I had picked up another shift? Like I could have done something different, even though I know that that's not true. I know that whoever was with him did everything that they could possible, but once you form that bond with people, you work so hard to try to help keep them here with us for their families, just to be able to get home and see their family members again. That stood out to me the most, because I just feel like I put so much time and energy and formed such a strong bond with him and his family. So that was a tough one for me.
Yeah, I can only imagine. And there are no words. There are no words when you hear stories like this. There are just no words. But thank you. LaTanya, let's switch gears just quickly, because there's some things I want to come back to you, Tangie, on, in terms of, you concern about the mother, but what now is the status of the baby? So I want to get back to you on that. But LaTanya, let's talk about, and I know I'm guilty, I saw your video recently about how to prepare when you go out. And, I was I was just so proud of myself. My first grocery store trip in this COVID-19 era, this is about 4 weeks ago, because I don't go to Costco as much. And people who watch this and follow me, I love Costco. So no, I don't go to Costco as often. But when I went to Costco the first time after COVID-19, I was just proud. And I took a picture of my prep. Now, Tara, you may just cancel all that out, but I was proud. And I was doing all the things, but when I saw your video, I thought, maybe I should have just done one or two of those things. So talk to us about how we need to prepare when we leave our homes to go grocery shopping, to go to the gas station, to go to work. Walk us through that.
I think the most important thing now, as data continues to come in about COVID-19 and that it's an airborne disease and that it can lie on surfaces for a prolonged period of time or still be in the air, I think it's very important for all of us to figure out how to get masks. Everyone's not going to be able to get the N95 mask that we have in the healthcare setting. They're really not on Amazon anymore. They're just kind of out, but many people are stepping up, helping to make those masks and make filters. And I think that's one of the biggest things that we can do is have that mask on. I took my teenager out for the first time to kind of get him used to having on his mask. He did a really great job and he kept it on. But I made a video, didn't expect it to be anything, a month or so ago, and it got like 40,000 views and so many thousand shares and all the rest of the stuff. But it was really simple. But what brought it on was I was at the gas station. I just got home from, or was coming home from work, and I saw this young mother with her two kids in the back seat. They were very small. One may have been a toddler and the other in a car seat. And she got out to pump her gas. And I'm just sitting there watching her, really. And she had on 2 gloves. And I'm like, okay, she's getting ready. So it's okay. What's she gonna do? She has her mask on. She has both her gloves on, and she gets her credit card and she's hitting the buttons and she's pumping the gas and she's just, doing everything. And then she gets back in the car to grab something. I don't know if the kid was crying, and then she gets right back out and she's touching everything, and she finishes pumping her gas and she puts the gas thing back up. She takes her ticket and closes the cap, just the whole thing. And then she gets back in the car with the gloves on, starts it, puts it in drive. I saw her reach behind to the car seat for a kid, and I was like, ah. So I should have probably said something to her, but she's like, over there at the pump. So in that moment, I keep gloves in my car. I keep wet wipes. I keep Lysol wipes. And I have always done this. And of course, I had my mask on me because I just left work. But I did this video about the one-hand glove technique, which I learned from MD Anderson about 20 years ago when I worked there in Houston. And it's literally just keeping a clean hand. It's not going to be sterile. There's not much that's sterile unless you create a sterile field, but it's literally donning a glove onto your dominant hand, that hand you're going to use the most. Take your wallet, get your card out, put it on your purse. And I don't even take my purse in the grocery store anymore. I literally just have my credit card. I put my phone in my pocket, and I just try to stay as clean as possible. But the video talked about being clean and about disposing of these gloves because it's causing so much cross-contamination. Once you touch something, you're dirty. So the easiest thing, if you do, I do it always for pumping gas, is I use that one hand. That's how I pump. That's how I put it up. That's how I key it in. And my credit card is in my clean hand. Swipe in, swipe out, and I stay outside my vehicle until I finish. I finish everything up, and I put that gas pump back into the handle. I take that glove off. And it's really the easiest thing to do, especially in the atmosphere that we're in. But 2 gloves is really messing everyone up. We actually ask them when they come in the clinic to please take their gloves off, because you've driven your car, you punch the elevator code, and you're just, and some people don't care about everybody else, but we're trying to keep an entire nation of people safe. Right. It's why we're going to work every day. I'm not going just for myself. I'm going because I want, you to be well and you to be well. And I want to protect my own family and my kids and everybody else. So it was just a really simple, kind of made out of frustration and sadness, honestly, that I did the one-hand glove trick to just keep that clean hand. Because once you take that glove off, that hand is technically still clean because you haven't touched the pumps. You haven't touched the keypad or anything else. And then I always get back into my car, hand sanitize before I touch my steering wheel. It's simple, and it's something we may have to adopt into our normal lifestyle now. And it's not hard.
Let me ask you this. So after I saw your video, I just said, I'm not going to try to use the gloves anymore because I might get myself confused.
And you don't have to. Hand washing will always prove to be the best thing.
Hand washing.
You don't have to, because everyone's doing the gloves wrong. So hand washing, scrubbing, and friction will always prove to be the best thing possible.
Let me ask you this, how effective is hand sanitizer? When COVID came out, well, when it wreaked havoc on our globe, in the news, people were talking about making your own hand sanitizer because it had become extinct by that time.
Right.
How effective is hand sanitizer?
The other ladies can chime in, but your instructors are always going to say hand washing is number one. We keep hand sanitizer with us everywhere we go, but hand washing is always, the friction that it causes and being able to lift and remove the dirty particles is always going to be number one. But after you've used hand sanitizers any more than 3 times, you need to wash your hand, because you're just compounding germs on top of the hand sanitizer, and it can't continue to penetrate through the layers of, you have sweat and everything else. So after 3 times of popping your hand under there, I really say 2, but after 3 to 4 times, you need to wash your hands.
To wash your hands. Good point. Now switching gears again, I want to talk about, we see so many things from our federal leaders, the federal government, our local leaders, and many times it doesn't mesh with our own perspectives and our own priorities. And Tara, you mentioned something very important. Not only are you trying to protect everybody else, but you want to protect your family as well. Considering there's this push to open the economy, and this is for each of you, and Kim, will start with you, Tangie, and then Tara. With this push to open the economy, understanding now in the state of Georgia, barbershops, tattoo parlors, and all of these non-essential, many non-essential businesses opened on Friday. Yesterday, restaurants and theaters opened. Of course, they have to follow strict guidelines, but how, from what you see on the ground level, how is that benefiting the progress we've already made? Kim, let's start with you.
In my opinion, I don't see it as a benefit. I feel like you're undoing all the good that we did accomplish with having people stay home. It's not going to make us any safer opening all these places, even with the restrictions. And I don't know if people will really follow the restrictions as they should, because honestly, there have been places that were open even with the, when he put the ban on, closing everything. I feel like there was still barbershops and hair salons that were still operating, just under the radar. So I'm afraid that it's just going to cause another surge for us here in Georgia in the coming weeks, because now people really aren't taking it as seriously as they were before, because the governor has opened the state. So it really leaves us in a bind. I feel like you want to support the people, like you said, going back to work, getting the economy back open. But the bottom line is, if you end up in my unit in the ICU, that's also going to be a medical bill that you're looking at. And if you don't make it through this, that's even more devastating for your family. Who's going to support them then? It's just the way that I look at it. So I feel like it was a bad idea. And I think it's also a slap in the face to the healthcare professionals who worked so hard to try to keep this contained.
Thank you, Kim. And before we go to you, Tangie, if you're watching now and you have questions for our medical professionals, please put them in the comments below and we'll get to them as soon as possible. Tangie?
Absolutely, I agree with Kim. I think that it is a slap in the face to the healthcare workers, because she gave a great example about how you work so hard with the patients, and these patients are very unstable. And so you work really hard with them and you do a lot of interventions, and we spend a lot of our resources mentally, emotionally, and physically to take care of the patients. I think that reopening so soon is going to overwhelm the healthcare system. I do not minimize the economic impact that this disease has had on the economy. I don't at all, but I think that we are not ready for a mass exodus of people to be out, because like Kim said, people were already not really following the guidelines, and we are constantly seeing patients who are infected and who are not just infected, but are symptomatic. And so it's overwhelming the healthcare system because we have minimal staff, because we have staff who are either ill or they are exempt or they have left and decided not to take care of the patient. So we have minimal staff, we have minimal equipment, we have minimal resources, and then we're going to have more patients. And it's just not, I don't think it's a good idea at all.
Tara.
I mean, I agree, and I work in research, and I just don't believe the numbers lie. I mean, I think it's in black and white, and I believe until we get down to single digits is really being way too optimistic, but I believe until we get those numbers down, as far as the people that are being diagnosed with the virus as well, if we don't get the numbers to start to test more people, then everyone is going to continue to walk around asymptomatic for up to 14 days spreading this virus. And, you know, the data's already told us that. They told us that I may have it now and not know it for 2 weeks. And everyone that I've come in contact with, my children, my neighbor, anyone, could be exposed to the virus. And then the numbers are going to go up. I think after this opening of Georgia, in a couple of weeks, we're really going to see what happens. But I think overall, it was not the best decision for health-wise. I think it was money over lives. I really do. I think we could have waited a little longer. I understand the financial disparities with people who work for themselves or who are not working, but if we're not alive, does it really matter that we missed our AT&T bill?
Exactly.
I don't know.
Yes, good points. Good points all around. On the other side of COVID-19, you know, I wonder, I think, am I going to have to keep gloves in my car, keep hand wipes in my car? Am I going to have to do all this preparation before I go out indefinitely? So in your perspective, what does life look like post COVID-19? Tangie.
I don't know if we'll have a post.
I think it's going to be like the flu. It's going to be around.
So.
I mean, it's not going to just go away. I think
so.
We're going to come up with ways to treat it better. And we may not lose as many lives to it, but I just don't see a virus disappearing. We've never had a virus that just disappears.
Right. I agree.
I apologize, Tangie.
No, it's okay. I agree. I was going to refer to you because you are the researcher, but
things don't just go away. They mutate, they turn into other things, but they don't go away. No. HIV has not gone away.
This is true. This is true. And it leads me to my next question. So we were talking about how we're doing this for our families and the people that we serve. We know, based on just the history of the African American community, that, you know, there are so many disparities in the health system economically, and certainly COVID-19. We also know that it impacts the elderly. It impacts us all for sure, but the African American community is disproportionately impacted. Our elderly certainly are very vulnerable. So for those who are on the perimeter of these communities, of these demographic communities, what do you say to them, considering many, in my view, take for granted the seriousness, the deadliness of this disease? What do you say to those who take for granted that, you know, this could certainly happen to you? Kim.
Well, you know, this is a difficult topic for me because I know quite a few people who really don't take it seriously. And I find myself in back and forth disagreements. And it's very frustrating because they focus so much on only people with underlying conditions or the elderly. But I keep telling people, when I go to work, I see all kinds of people. I see young people, I see old people. There are people who were sick, there are people who were healthy prior to this. So it can affect anybody. There's no person that's exempt from it. You have nurses and doctors who have died from this virus. So I try to encourage people, just try to take better care of yourself. Think about your children and your mother, people that you love. How would you feel if you passed along something to them? Make it not just be about yourself. Think about those around you who you truly love, and how you would feel if you gave them something that killed them or made them, spend time in the hospital and you not be able to go see them and, be there with them. So just not be so selfish. But it's very frustrating because I feel like sometimes I'm talking to a brick wall with a lot of the people that I'm coming into contact with. They think it's fake and they don't believe it, and the media is just hyping it up to scare us. So it's just frustrating.
Tangie.
I agree with Kim. I think it's just, I think social media is, what it's worth has lent to spreading falsehoods. And in all fairness, we are learning more and more about the disease and who it affects and all of that. But I think that there is a subculture of our community that is listening to a lot of the conspiracy theorists and the myths, and they don't believe it could affect them. They don't believe it could affect them if they O positive. They don't believe all these just crazy things. And so you're trying to speak to them and say, no, this can affect you. And I heard someone say on the radio that we don't believe it'll happen to us until it affects Big Mama. And so, like Kim said, we have to try to appeal to them on a personal level. Just say, how would you feel if your daughter contracted this disease, and just try to come from that angle. The other thing too, I think that is important to talk about with just minorities and how we're affected is that we're also economically disadvantaged coming into this sometimes. And so that's driving a lot of our decisions. So yeah, I hear that, but baby need a new pair of shoes. And so it's really a very, very difficult field to navigate, trying to appeal that this has to be for your health and for the health of your family, and not be so self-absorbed and not be so selfish in how you are moving about.
Sure. Tara.
It goes back to that old saying, and I hate to generalize us as a people, but sometimes Black people just don't believe fat meat is greasy. I don't care how many times you say it. I don't care how many times I give them a scenario where we've lost someone. Even with cancers, we die at a higher rate because we want to pray that lump away. There ain't nothing there. Them doctors just want to give me this medicine. No, they go home to their family. They give you the information, and it's your decision to figure out what to do with that information, to process it. And just to add on to what the other young lady said, I know they do as nurses, but I advocate in the community so much, and I attempt on social media to downgrade those conspiracy theorists and say, no matter what you believe, it is real. I've lost 2 people from it, and they were healthy people. These are not people who, were sick in any way. And it's still so hard. It is really hard. And until it affects them or someone close to them, they just don't always believe that it's real. And this dates back hundreds of years by, not believing what someone may be telling them because it's a setup and 5G and towers and, and they put it in the Black people area. And I'm like, guys, I work in a predominantly white setting. And white people are dying just like Black people are dying, but we are dying at a higher rate than anyone else. We always wait to the last minute to get treatment. We're worried about finances don't come before your health. If you don't feel well, you need to come in. And that really is the case. And I think that we just get caught up in these ideologies that just don't make sense to us. But we continue to pass it down from generation to generation, and it is very, very difficult. But I think we try our best to tell people to that it's real and that they need to prepare themselves. If you're not looking out for yourself, at least the family that you're around, at least the people that you love, protect them.
And I want to go to that health piece. Tangie, I understand that you're the creator of Healthy Sisters Rock. But before we do that, I want to let Satricia Moore know that we do have your question. Let Tangie answer this and we'll get to your question. So Tangie, talk to us about, Tara was just telling us, and we know that, of course, this disease disproportionately impacts our community, and other diseases disproportionately impact our community. I followed your health journey some years ago, and let me tell you, I was just so impressed and just so shamed at the same time because I wasn't doing my part. But I've seen you transform. We know that COVID-19 attacks those who have high blood pressure, those who are overweight, those with diabetes, and those maladies, if you will, impact the Black community, the African American community. Talk to us about your health journey, how you think it set you up to be strong and healthy, to work in the medical field during such a time as this. Share with us your journey and talk to us about what people can be doing now. They're home, many people are idle, many people are working from home, the Zooms day in and day out, not able to, get out and get fresh air, but talk to us about ways that we can improve our health during this season of rest, if you will.
Thank you. So just briefly for myself, I have been working in the healthcare field. I've been a nurse for 15 years. And so I know all the data. I know all the things to do, as most of us do. But I was busy. I didn't have time. I didn't prioritize it. And I just really got tired of struggling with my blood pressure, struggling with my weight. And just really wanted to embody. If I felt sort of hypocritical if I was sharing with the patient about taking care of herself, and here I was, excuse me, out of breath or busting out of my scrubs. And so that was just me. That was my thing. And with Jesus's help, then I was able to make some changes. I think that I think we get overwhelmed because we're trying to do too much too soon. We try to say, okay, I'm going to, go vegan and I'm going to run a marathon and different things like that. And we don't really just think about the impact the small changes can make. And so if you are a person who's working at home and in front of the computer all day, we know that it doesn't matter even if you exercise, but those hours that you spend sitting, they're counterproductive to the exercise that you've already done. So make it a point to get up. While you're on the phone, if you are not video streaming, if you're on the phone, stand up and walk around and talk. Set your computer up so that you can stand while you're talking. Make sure that you have your water at your desk, staying hydrated. That's gonna make you get up and go use the restroom. Have a snack. Don't always reach for the chips. I'm not saying go for the carrot sticks because, hey, let's be honest about that, but just be mindful of the things that you're putting in your mouth, because if you can't move like you need to, what you put in your mouth is what's making the difference. And so COVID-19 just pretty much exposed the health disparities that we already are presented with. And that's part of why we're, affected more. But I also have been seeing it in not just the African American community, but other racial communities as well. And so when you trace it back, it's all lifestyle. And so right now, today, if we begin to make the smaller choices to help, I've seen the different things about the immune boosters and all of that, and that's great and fine. But let's start with basic stuff. Let's eat more vegetables and drink less soda.
Thank you for that. Thank you for that. Although, a Sprite a day will keep the doctor away.
Well, that's what's wrong with y'all now.
Yes, no, I don't advocate overconsumption of sodas.
That's what's wrong now.
We do have a question from the audience. So Tricia Moore asks, if schools open back in August or September, from a medical perspective, how can teachers help keep students safe in the classroom? Kim, let's start with you.
Well, I think it will be important for them to make sure that the kids are washing their hands properly. Keeping hand sanitizer will help keep some of the germs away. I don't know how they're going to do as far as like having the kids wear masks. I don't know if that's going to be something that's new to the schools, but I know that they've already been teaching kids to cover, cough into their elbow, sneeze into their elbow, use a tissue. And I think it's going to be important for parents to support the teachers with sending supplies in if they can, as far as like Kleenex, also the cleaning wipes, the Lysol and Clorox wipes, to just kind of help keep things clean. And I would, encourage teachers even to have the students wipe down their desk at the beginning of the day, at the end of the day, after lunch, just wipe things down periodically, help out to keep everything clean, and just even have, hand washing time. I don't know, just do a lot, whatever you can to incorporate cleaning and cleanliness to kind of help keep everything at bay.
How concerned are you about sending your daughter back to school in the fall?
I'm I'm a I'm not sure about it. I just want to kind of see where we are with the virus. I do teach her about trying to stay clean, but then of course you do have people who send their kids to school who are sick. So it's a little concerning, but I just try to stay encouraged, and I try to pray over her every day to make sure that she remains healthy, and I teach her to do the right things. So I'm just hopeful that we have some resolutions by the time the kids are ready to go back to school. We have more information. I'm sure we will. And I'm hoping that the schools will put some things in place to kind of help keep the kids as safe as possible.
Yeah, because the saying is true. It takes a village.
Yes.
And particularly in this COVID-19 era, it takes all of us working together to keep ourselves safe, to keep our families safe, to keep our children safe. LaTanya, what are your thoughts in reference to Satricia's question? What can teachers do to keep their students safe?
I think everything Kim said, I would copy that. I think one thing we did in the hospital or clinic setting is we have environmental services come in, and they are wiping down high touch areas. So all doorknobs every couple of hours are being sanitized down, because those are things you're going to be touching constantly. People who don't practice good hand washing or whatever the case may be, patients are in there, they're not really familiar with good hand washing all the time. So I would add on that making sure that high touch areas are wiped down constantly. And I think we have to start at home, like you said, and the kids are going to have to be diligent themselves about making sure that they stay clean. Wiping their desks down before, they walk out of the classroom may be a reality, and parents will have to get on board with making sure sanitizer is inside of the classroom and helping those teachers out, because you have one teacher for 25 children and they can't do it all by themselves. So I think it's going to take, especially the bigger kids. I have 2 middle school kids. They're going to have to put in that effort to make sure they're safe as well. They're going to have to help their teacher and support their teacher in their classroom. I don't know if we'll start school in August. I'm like Kim, I'm going to play it by ear. I would doubt, with everything that's going on, if they started school in August on time, my kids won't be there. But we'll see. We'll see what the numbers say. I think it will probably be delayed until we get less numbers, because you're talking about, my kid's school has 1,500 students there. That's a lot of breeders. So that's a lot of people walking in the classroom, walking in the front door, going to the gym, sweating. It's a lot of kids. So the teachers are going to have a really big task at hand if we still have some traces of this virus by August.
Tangie, do you have any more insight to share on that? What teachers can do to help keep their students safe?
The only thing I would add, it wouldn't necessarily be the teachers, but I would just encourage the parents to not send their children to school sick.
They won't stop doing that.
If we could do some pre-screening, prior to them getting to school, and I understand that's a whole different thing because, parents might have to work, they might have childcare and different things like that. But if we can not send the children to school sick with a fever or with cough or anything like that, with any symptoms, then we can at least stop that part. And then when they're in the school, they can do the sanitizing and all that.
Yeah. My question is from a lay perspective, as someone who, needs sanitizing wipes in her home, where do we find this stuff? Of course, we have to resort, I would imagine, to doing our own makeshift wipes using Clorox bleach and some paper towel and calling it a day.
It may come down to that.
Yeah, for sure.
My husband made hand sanitizer himself. We have giant bottles everywhere. But
well, look, Tara, what you can do is go on and market that.
I don't want to go to jail. He's like, I'm going to sell it on eBay and see what happens. I'm like, I don't know about that.
Oh, goodness. We have another question from the audience, Andrea Mid. She wants to know, should we say goodbye to cooperative learning? Anyone familiar in the school setting of cooperative learning? Can anyone address that?
Can you expound on it? Is she talking about just virtual learning or?
Yeah, Andrea, if you're watching, if you could clarify your comment or your question in the comments, that would be great, and we'll come back to it. So we'll come back to you, Andrea, just if you can clarify that comment. And while she's doing that, Tangie, I want to come back to you about, you were talking about, your concern is certainly for the mother, but then there's another piece. You have to concern for the child. What does that look like? Like when if a mother is tested positive for COVID-19, forgive my ignorance, but does the child then stand in jeopardy of contracting that virus as well, or the disease as well?
No, and so we have found that mom's immunity extends to baby. So the babies are not they're born negative. We've seen that. Breast milk does not carry, we have not shown any studies to carry the virus. So in that regard, the babies are protected. I think what the bigger problem becomes is, can we keep mom stable enough so that she can begin to nourish the baby? And if we have to deliver her emergently, is she at a gestation where the baby could survive outside? And so the floor I'm on, we try to keep them pregnant. And so we're constantly battling with keeping her healthy, keeping her organs perfused so that she could perfuse the baby so that we can get her further in the gestation to have a healthy baby.
And you said something important, keeping the organs healthy. There's so many stories out now, research out now that are findings, because again, this is the new coronavirus. It's something that's unprecedented. We don't have a model for this. We're creating the model as we speak, as we day in and day out go to our jobs and do more research. Oh dear, I think I just lost my thought. Forgive
organs perfused.
Yes, thank you. So this disease is impacting not only the lungs. I've been reading it's impacting the heart, the liver, the spleen. So this is not just a demographic. This is not just a region. This is a human condition. This disease impacts the human condition. And I'll just say it frustrates me when I hear people talk about, well, we need this, we need to get back, we need to, because if not, no, if we're not here, if our condition is wiped out, there's nothing to get back to. There's absolutely nothing to get back to. All right, so Andrea Mid, she did provide clarification in terms of cooperative learning. She wants to know if students will have to, let's see, should we say goodbye to students working in groups? So in the classroom setting, I'm assuming this is in the classroom setting, should we say goodbye to cooperative learning, students working in groups together? Any thoughts on that?
If I'll say that I don't think you would have to stop students from working in groups, but I would think small groups would be okay. Groups of maybe 4. I'm not sure how it works now, but I mean, I just think smaller groups would be okay. And again, just back to getting everything sanitized before you start, after you start, making sure everybody's hands are washed before and after. And again, maybe wearing masks to school. I don't know. But I just think that, working in smaller groups may be something that they can look at versus just cutting it out altogether. That's just my thought.
Sure. Anyone else? If not, we have another question. Candace Green, thank you, Candace, again. She wants to know, how are you all coping emotionally through this health profession, through this health crisis? How is Tangie's condition? How is Kim's condition? And how is Tara's condition? Tangie.
I will say that I have good days and I have not so good days. I'm most vulnerable. I told my husband this the other day. I'm most vulnerable after my shifts. I feel very powerless and open and weak and weepy and tired and overwhelmed. And I'm a believer. So I lean into my faith. But just the reality of dealing with this battle throughout my shift is very consuming on me emotionally and physically. And so I have to take the time to build myself back up to get prepared to go back into work. And so I do that through prayer. I do that through exercise. I do that through creative means, and I do that through counseling. So I try to put everything in place, and yet when I go in, it is still a battle and it's still a lot. And I saw, I think it's really, really important. I'll just say this real quick, that those of us that are caring for these patients on a consistent basis, that we find a way to decompress in a healthy way and get a good support system in place. And it may not necessarily be someone that's outside of the healthcare arena, because they might not can get it. But I know my organization that they're offering, they have chaplain services. They also offering counseling through EAP. And I would just appeal to healthcare workers to take advantage of those resources, because this is literally a traumatic. It is a trauma that we're walking through. And I think that, of course, we put on our shields and we go and do our thing, but it is taking from us on a daily basis.
Yeah. Tara, how do you fill your cup?
I'm honestly sad about it. I'm a big extrovert, so I like walk into every room like laughing, and how are the grandkids and how are the kids, and I love to travel, and where'd you travel to? And like, I become family with a lot of my patients and a lot of people that I take care of a long term. So I take care of somebody for 2, 3, 4, 5. I have one patient I've had for 6 years who's a stage 4 lung cancer, who has set records. But it's sad because I have a mask on when I walk in. She has a mask on, when I walk in. You can't hug, you can't touch, you can't, and I have one patient, she started crying and she said it was a time, her treatments are the time when her best friend is able to come with her, and they have that time together. So not being able to really hug her and be there for her, it's just not a great thing. At home, it's been difficult because my husband and I both are healthcare professionals. So we had to sit down and have the conversation with, because we go to a hospital every day, our kids are high risk. So our kids can't play with anybody. Our kids can't go anywhere. They couldn't go to my parents so that we could go to work, because our schedules haven't changed at all. We still going to work every day. We're still doing what we're supposed to do. So it was a lot of guilt with, if I were, especially when the nurses, my counterparts started getting sick, it was the guilt of, what if I'm bringing this home to my kid? What if my kid gets sick? What if, I get sick and my kid doesn't make it, but I make it, the guilt that comes with it. So it's really exhausting, I think, which is why it makes it so tough to accept that the government opened up places that really could have waited a little longer, because it's like, we're working so hard and you're making us work harder. So it's a lot of guilt that comes with it, even, for us who are not dealing directly with COVID-19 patients, because we've had to change the way we care for people completely.
Kim, how are you coping?
Well, I agree with both ladies. For me, it's pretty much the same, like what Tangie said. I feel most vulnerable after I've worked. And again, you're just exhausted from all that you've given, emotionally and physically. And the other part of that is just like what Tara said, my family, coming home to them. I have this whole process where I change clothes at work. I come home, I'm stripping down and putting everything right in the washing machine every day. And I'm spraying Lysol on my shoes. I mean, I'm doing all these things, but I'm still afraid that, I could be passing along something to them. And so I'm the same way. My daughter hasn't seen her grandmother. She can't go anywhere because I'm like, listen, I work in a hospital setting. If I give you something, even though you're not sick, I would feel horrible if you went somewhere and someone else got sick, so it's a lot to deal with, but I do have a strong support system. Like Tangie said, we have chaplains, we have counseling at my facility. A lot of my coworkers have gotten together. We formed like our own little support group. And one of my coworkers, his wife is a counselor, and she's extended her services to us for free. So we have a lot of outlets, and of course, praying continuously is the only thing that helps me. But I do feel like a lot of healthcare workers are going to come out of this with PTSD, and I mean, because it's so traumatizing day to day, just even the physical part of it. You're in a room for 45 minutes with all these things on, sweating your brains out, and you come out for a breath of fresh air just to run into another room, basically, because somebody is crashing. So I think it's going to be a lot of traumatic stress disorder from this. So
yeah. Ladies, this has been phenomenal. For those who have questions, I asked Tangie, Kim, and Tara if you would take some time when you think about it, if you could go and once we sign off, just go in if there are any questions that we missed, if you could take a moment to address those. But before we sign off, I'm getting word that we have one more question. We have one more question. Okay. This is my production manager over here telling me questions. And then my other production manager on the other side. So I appreciate them both. And this speaks to what you just said, Kim, about PTSD. What are your thoughts? Is this the doctor that yeah, there was a doctor. So for those that don't know, the not New York Times, oh dear, I just read it last night, but many news outlets have reported that there's a doctor in New York, I think it's Manhattan Hospital, maybe, but it's in Manhattan in New York. She committed suicide. She took her life. She died by suicide. There is a distinction, because this has just been all consuming. And so the commenter wants to know, what are your thoughts on that? And Kim, you I think it was Kim said, no, Tangie, it was you, making sure nurses and doctors have an outlet to release the pressure that builds during the day-to-day workday. So what are your thoughts on that? What would you say to a nurse? What would you say to a nurse? And I'm sorry to the person who asked this for rephrasing this, but it speaks to this. What would you say to a nurse just graduated nursing school, going into the hospital today, walks into a ward that strictly, Kim, your ward, COVID-19 patients, what would be your advice to this young woman as to how to maintain a good mental health and wellness walking into this situation?
Well, on my unit, we have several actual new grads that have started right before this. So my advice to them is always to just feel what you're feeling. If you feel like you need to take a moment and cry, you go, take this stuff off, go and cry. Let it out. Don't try to bottle all these things in, because we can't hold it all in. You've got to feel it. And there are days when I get in my car after I work and I just bawl. I mean, I just let it go. If I feel like screaming, I'm going to scream. I feel like you just have to let it out, whatever it is. And try not to hold on to things that are making you angry. If you're frustrated, just find somebody to talk to about it. Write it down, throw it away, burn it, whatever you have to do to get these feelings out. I feel like that's what is going to be most important. Not trying to hold all this in, not try to be everything for everybody, because you can't. It's not possible. So that's the advice that I always give.
Thank you, Kim. Anyone else? Tangie, Tara?
I was just going to say also minimize what you're consuming as far as media. That was huge for me because it can be very anxiety provoking, and it does push you in a feeling of helplessness and powerlessness. And I can't imagine what that doctor was feeling. And it makes you feel like, what good am I doing? So you have to, I would say, minimize the intake of the media. And get you some people, like she said, you just be able to get it out, but get you some people that you can just talk about it without judgment, without having to re-explain, without have to justify how you're feeling. I saw someone say this today, and I thought this to myself, because loss is loss, and we're all grieving it in a different way. And sometimes, for me personally, and I've seen other healthcare providers feel kind of guilty because I am still able to work. I am well. I don't have any financial concerns or anything like that. And so I would feel bad if I felt some kind of loss. But what that was doing was causing me to internalize more pain and more grief and more loss. And it was not allowing me to be well. So acknowledge that whatever your loss is, it is still loss. Don't feel guilty because our loss is different, and find a way to be able to healthily manage that.
Thank you for that. Atira, did you have any thoughts on that?
I agree with both the ladies. I think you have to understand, as a new grad and experienced nurse, that the gamut of emotion that we have makes us human. And never to suppress those emotions. You need to get through your shift and you need to be able to do the best job you can, but it's okay to have those emotions. Even though they're not your family, nurses, we care about everyone's life. So that was somebody's family member, and we did not want to lose them, especially on our call. I think everyone needs to have an outlet. Everyone needs to have a prayer partner. Everyone needs to have a group. You can't keep, like Kim said, you can't hold it all in. You have to be able to express yourself. You have to be able to express those emotions. It makes us real. It makes us human. It makes us normal.
Mm-hmm. In honoring the COVID-19 disease, coronavirus, we have to honor, as I've heard from you all, the myriad of emotions that we experience day in and day out, not only in the health profession, but lay people like myself. Like you, we have these concerns. What would happen? The what ifs, because again, this is new. We don't have the template to follow. So the what ifs are constantly, at least for me, my family says, well, Paulette, if you have faith, you shouldn't fear. While true, we're very human. And this is a scary time. But of course, maintaining mental health, emotional health, and spiritual health, which is something we'll be talking about tomorrow, that I'm glad you all shared with us today as to how you're dealing with this. It's critical. It's critical. Joseph Collier has a question. Joseph, if you will just hang tight, our panelists will, on the back end, go in and address that for you, whoever sees impressed to answer that for you. Ladies, thank you so much. This has been phenomenal. I appreciate the time that you've taken out of your schedule to talk with me, to talk with Facebook, to talk with the world about your experiences